Michael James here. If you've ever had a sciatica attack, you know that your only thought is how to get some relief from the sciatica pain. The pain can be so intense that it becomes debilitating. Some sciatica sufferers can become bedridden due to the intensity of the pain. It usually is a sharp, burning pain that originates in the lower back and transmits down the back of either or both of your legs. At the age of 62, I had two almost back-to-back sciatica attacks that combined lasted for over 6 months. When I researched the treatments available for sciatica, I found that there were 3 categories of treatment for relief of sciatica pain. Those categories are number 1, medication, number 2, surgical procedures, and number 3, non-invasive treatments. The first category is medication. Medication is the first of 3 categories that can provide temporary relief for sciatica pain. There are 2 major categories of these drugs, painkillers and anti-inflammatory drugs, which are available as prescription and over-the-counter. Be sure to consult with your healthcare provider prior to adding any medication to any treatment regimen.
Painkillers. The first type is prescription. Prescription strength acetaminophen is available for more severe pain associated with sciatica. In some cases, acetaminophen with codeine or oxycodone will be used to mask the sciatic pain. This medication is rarely given for any extended length of time due to the addictive nature of these drugs. The major drawback is that they do not correct the cause of the sciatica pain, and therefore it is not a long-term relief for sciatica pain. The second type of painkiller is over-the-counter. The common over-the-counter medications are aspirin, acetaminophen, and ibuprofen. As with prescription painkiller, these over-the-counter medications can provide relief from sciatica pain temporarily. To gain long-term relief from sciatica pain, you have to address the cause of the inflammation. The next category of drugs are anti-inflammation drugs. First type is prescription. These drugs are commonly referred to as NSAIDs, which stands for non-steroidal anti-inflammatory drugs. They block the production of COX enzymes that are a precursor to actually create a substance that irritates the nerve endings and hence the body's awareness of sciatica pain. Some of the more common drugs are meloxicam, ibuprofen, oxyprozin, and celecoxib, just to name a few. While these medications will reduce the pain and inflammation and many times alleviate sciatica pain symptoms, it's important to make changes necessary to assure long-term relief from sciatica pain. The second category of anti-inflammatory drugs is over-the-counter. Depending on the severity of your sciatica pain, the use of aspirin or ibuprofen will sometimes reduce the minor inflammation that caused the pain associated with sciatica.
The second category is surgical procedures. Some sciatica sufferers looking for relief from sciatica pain use surgery as a solution. The type of surgical procedures that your doctor feels is necessary to correct lower back pain and acute sciatica will depend on the underlying condition of the spine and the lower back area. Sometimes the sciatica pain can be caused by disc problems, and if this is the case, there are several procedures that can be initiated.
Note, surgery is an invasive procedure. There are different results for similar patients, so you should consider using non-invasive procedures prior to employing surgery as your chosen method to obtain relief from sciatica pain. Be sure to consult with your healthcare provider to learn about the many options that are available. The first one is microdiscectomy. If a herniated disc is causing your sciatica pain, there is a procedure called microdiscectomy that physically removes the cause of the compressed sciatic nerve. Laminectomy. When the nerve compression is caused by spinal stenosis, your surgeon may choose to do a lumbar laminectomy. Simply put, the procedure involves removing bones from the vertebrae to create more space for the nerve bundles and hence alleviate the compression and inflammation associated with sciatica pain. A discectomy. One of the first procedures developed to treat sciatica pain was a discectomy. It involves actually removing the damaged or diseased disc from the spine to remove the pressure on the nerve. Spinal fusion. This is an option of last resort. As a general rule, most surgeons will not employ this tactic unless the spine has advanced osteoporosis or years of physical injury from accidents or sports injuries. The major drawback is that the procedure will dramatically limit the mobility of the spine once completed. It involves joining 2 or more vertebrae together in an effort to relieve irritation and compression of the spinal nerves.
Number 3, non-invasive procedures. The majority of sciatica sufferers don't require surgery as a method to gain relief from sciatica pain. By employing these low-impact methods, the majority of sciatica sufferers can obtain a pain reduction and, in many cases, elimination of the underlying causes of the sciatica.
Exercise. Exercise is a good solution to minor and low-grade sciatica pain because it will train your muscles to become stronger and more flexible. This is especially important regarding the piriformis muscle because the sciatic nerve runs right through this muscle group. If you employ exercise as a method to stretch and create flexibility within your body, you should reduce and many times eliminate your sciatica pain. Specific exercises are covered on pages on this website. Hydration. Hydration is critical to any effort to find relief from sciatica pain. Your body is 3/4 water. If you become dehydrated, the normal body functions that are designed to create optimal health become compromised. Water is designed to work with the body's organs and systems to flush toxins from our body and aid in its self-healing function. Staying hydrated will assist your body in dealing with toxins that are produced by the inflammation present in most sciatica episodes. Nutrients or supplements. Every machine needs fuel to operate properly. What we put into our bodies is very important to our ultimate health. There are specific vitamins and minerals necessary for the proper function of our nerve, muscle, and our spinal column, which directly impacts the intensity of our sciatica pain. The nutrients and supplements can be added to our everyday diets through over-the-counter supplements or specific food groups. Posture. The effect of proper posture can't be emphasized enough. Stress and pressure can aggravate sciatica pain, and poor posture can put additional pressure and stress on the lower back. These are just a few of the strategies to impact your sciatica pain. There are a dozen others that you can employ. If you're looking for relief from sciatica pain, knowledge is power. Every person is different, so the results can vary depending on your commitment to the program. Go to www.thesciaticapainresource.com and click on the Sciatica Pain Resource Guide for more information if you're finally tired of sciatica pain and are willing to make lifestyle changes. Be sure to sign up for the free mini course to gain additional insight into your condition. Don't delay, it's free. Do it now.